Now, if you're stressing out because you're not getting pregnant and you want to take the fast route, then this video is for you. Hi, this is Dr. Marc Sklar, the fertility expert, and you're watching Fertility TV, your YouTube channel dedicating to empowering your fertility and helping you get pregnant. If you're trying to get pregnant, subscribe and hit the bell so I can help you too. Dr. Park spent the first 10 years of her career as a fertility physician at Columbia University in New York City, considered to be one of the leading IVF programs in the United States. She joined the San Diego Fertility Center in 2012, where she combines her extensive experience as an infertility physician with personal care. In 2017, Dr. Park was named top doctor by the San Diego County Medical Society in San Diego Magazine. Okay, so we are back with Dr. Park from San Diego Fertility Center. If you haven't watched the other video where she gives you all the information, the nuts and bolts about fertility treatments and your options, then go check it out. But in this video, we're talking about genetic testing. So she's going to give us a little bit of education about what all the genetic testing means and what your options are.
So this is a very common question I get, and people understandably are very confused. Okay, so let's divide it into two categories. So there is the DNA mutation, and then there is the chromosome number.
Okay.
So DNA mutation. So the egg source gives 23 chromosomes, and the sperm source gives 23 chromosomes to make a 46 chromosome embryo, which so all of us have 46 chromosomes. Embedded in the chromosomes is our DNA. That tells us our eye color, our hair color, how tall we are, etc. And it's very normal to have mutations in your DNA, a lot of which honestly mean nothing. But sometimes they do. So an example of this is cystic fibrosis, right? Which is a mutation in chromosome number 7. The cystic fibrosis is what we consider autosomal recessive disease, meaning both chromosomes need to have the mutation of chromosome 7 to actually be sick. But what if only one chromosome has it? Then you're considered a carrier because the other chromosome doesn't have the mutation. Okay? But there are diseases that are what we call autosomal dominant. An example of this is Huntington's disease, which means if one chromosome has it, it doesn't matter that the other chromosome doesn't have it, you're sick. And so one of the responsibilities of your healthcare provider is to take a family history and be able to glean if there is any evidence of these DNA mutations. And you should be able to pick up autosomal dominant history just based on a conversation with the patient.
Sure.
But autosomal recessive diseases are tough because how would anybody know that they're a carrier of a mutation if they're not sick? So that's where DNA mutation comes in. Okay. So you are given these mutations from your egg source and your sperm source. So they don't change with time. So whether you're 40 or whether you're 25, it's the same.
Yeah.
Okay. The problem is this: there are hundreds upon hundreds upon hundreds of mutations.
Sure.
And we're just not capable of testing for all of them. And right now, the most comprehensive company will only test for about 300 of them. Okay? And so it's simple. All it requires is a blood draw. Okay? And the test really varies by company, but it's going to be a couple hundreds of dollars. Okay? I guesstimate somewhere between, I would say, $250 to about $400. It's probably a ballpark. Okay? And they draw you blood, and they'll run for about 300 different mutations. But the thing is this, that even if you come back negative for mutation, that doesn't mean you don't have the mutation. It just means to the best of their ability they don't think you have the mutation because there's an error rate, right? You can't detect every single mutation.
Not perfect.
It's not perfect.
Yeah.
And then think of all the mutations that weren't tested for in that kid, right?
Right.
But this really has become a very commonly requested test. And I do believe it's the way of the future, right? As our DNA technology is advancing, that the future is going to be that everybody's naturally going to get the DNA mutation sequenced. But right now, we're capable of only about 300. Okay.
And they would do that before they start the IVF process?
That is our preference.
Okay.
And it takes about 3 weeks to get the results back. So sometimes I have patients that say, oh my gosh, yes, we want to do it. Oh, and by the way, I'm getting my period next week, so I want to start treatment next week.
Right.
So I remind them that, but we're not going to have those results back.
Sure.
Right? And I think of all the people, right, your family members, your friends, who've had children who are healthy without even knowing these results.
Oh, yeah.
Right? And so sometimes just because you can do a test doesn't really mean you should do it.
Sure, absolutely.
And the way I counsel my patients is, what are you going to do with this information? And if you really think that, gosh, it would really make me feel less anxious if I just sort of knew that I did everything possible to make sure I had a healthy child, then I say do it. But I have other patients who actually become anxious because of these results. And so I tell them, then don't do it.
Don't do it.
Don't do it. I mean, you guys have been trying for a year on your own with sex without even knowing this information. So why would you do it now if it's just going to make you more anxious?
Okay.
Okay?
Are you going to go into something
The PGT.
Go for it.
All right. So that is DNA mutation testing, which is in the way you're born. It doesn't change with time. Well, let's contrast that now to what people have called chromosome testing or comprehensive chromosome screening or pre-implantation genetic screening, pre-implantation genetic testing -A. It's all the same.
All the different letters.
Oh my goodness, right? So now what they want us to call is pre-implantation genetic testing -A, which stands for aneuploidy.
Okay.
But what is aneuploidy? So we get 23 chromosomes from the egg source, 23 from the sperm source. However, when they combine, sometimes mathematical errors happen.
Yeah.
And these mathematical errors are more common when the egg source is older. Okay, so this is not something you're born with. This is a new event every month. Okay, so again, a woman has 46 chromosomes, but right before she ovulates, her eggs will divide the chromosomes in half, 23, 23. And one of the 23 has to go meet the sperm, which already has 23 chromosomes.
Mm-hmm.
But as a woman gets older, when she has to divide those chromosomes in half, which happens every month at the time of ovulation, the older she is, the more likely the division is uneven. Okay, so maybe she'll pull 24 one way, and then this then mathematically has to be 22. So if 24 chromosomes goes to meet the 23 chromosomes from the sperm, then the sum is 47, not 46.
Right.
And for example, if that extra chromosome was chromosome 21, that is how you get Down syndrome.
Yeah.
But that extra chromosome could be chromosome number 1 or 10 or 18.
Yeah,
it doesn't
go to
have to
any
be
one
21.
of them. Yeah.
Correct. Or if you're missing a chromosome, right? What if you have 22 chromosomes from the egg, but it should be 23, going to meet the sperm? Again, depending on which chromosome is missing. For example, if it's missing an X chromosome, that child who only has just no X and just either another X,
right,
is Turner syndrome.
Sure.
Okay, so these incorrect numbers of chromosomes, which is related to the age of the woman, is another type of genetic testing you can do, but you can only do that before pregnancy by doing IVF. Right? So in IVF, you create the embryos, and when they're 5 days old, you take a little sample of every embryo, and then you run the test. Or you don't have to. If you got pregnant on your own through sex or IUI, right? Or even IVF, but you chose not to do the chromosome testing, you will know this answer when you're 3 months pregnant. Through a blood test called cell-free DNA, or people call it NIPT, non-invasive prenatal testing.
Mm-hmm.
And you'll get the same result. The error rate is actually less when you do it when you're pregnant.
Yeah.
The error rate is actually higher when you do it through IVF because you're doing it at such an early stage. And also, a lot of people feel that, okay, I've done PGTA, and so I'm going to have a healthy baby. And that's not true.
Not necessarily true. Yeah.
I've been in practice 15 years, and if you don't practice long enough, you will have your share of surprises. And I have seen it go both ways, where I have transferred a normal PGTA embryo, and when she was 3 months pregnant, the blood test showed it wasn't normal.
Mm-hmm.
And I just recently had a delivery of an embryo that I transferred that was abnormal, and it turned out to be fine. Okay? And so just understand, just because a test exists doesn't mean you have to do it, but whenever you do any test, ask yourself, how is this going to change the management of my pregnancy?
Right.
Because these tests are expensive. So if it's not really going to change what you want to do, do you really need to do the test? Now, one advantage of doing that test is gender selection. Right?
Absolutely.
Which I fully support, I understand, right? So if you have 3 girls at home, I understand that you would like to have a boy, or vice versa, right? Or some people actually do it for certain medical conditions, right? But to do that, you must do PGT. So you have to do IVF, and then you have to do the PGTA, so we can know the gender of the embryo before we transfer.
Are there specific cases where a patient comes in with a certain history and it makes you say, you know what, based on this, I highly recommend doing the genetic testing before we transfer the embryos?
Yes, so there's a type of disease called X-linked disease, where the disease affects predominantly boys. And so in that case, if they have that disease, I would tell them, I really think you should do this, let's just transfer boys.
Okay.
Or there's another type of disorder. So when you do, if we go back to the DNA testing, I had mentioned Huntington's disease, right? So let's say you are a carrier of an autosomal dominant disease. Or let's say you're not and you carry cystic fibrosis and so does your partner, right? So in that case, we do recommend doing IVF. We biopsy the embryo, but we're not looking at the number of chromosomes. You can actually create a probe to match that DNA sequence.
To find it.
To find it in the embryos, and the embryos that are affected, you just throw them out.
And those are the main reasons why you would say?
For medical reasons. Yep. Okay. Yep. Or let's say a woman came to me, she's had 3 miscarriages, right? Usually, over 50% of miscarriages are due to incorrect number of chromosomes. So in that case, I would tell her, listen, I would really recommend you do the IVF. Let's check the number of chromosomes, that's PGT-A, in each of your embryos, because I suspect that that's probably the reason for the miscarriage. And so let's try to transfer the embryos to have the normal chromosomes.
Great. Well, hopefully that wasn't over everyone's head. No, but I mean, I don't think it was, but as you're listening, that should really give you a good solid foundation for genetic testing, when to do it, what its purpose is, and hopefully that helps you on your fertility journey. So thank you so much for all of that, and thank you for watching, everyone.
Thank you.
If you found this video helpful, there are 3 things I need you to do right now. Number 1, give me a thumbs up and click in the comment section below to let me know what other fertility experts you'd like me to interview on this channel. Number 2, subscribe to Fertility TV to get the best tips on how to get pregnant naturally. And number 3, download the IVF code. It's the must list for anyone thinking about IVF.